Mistakes happen in all areas of life, but one of the places that it's probably more frustrating than anywhere else is when a mistake happens with a healthcare issue or a medical bill. So, in this video, I wanted to talk about mistakes people can make on their medical bills, mistakes the providers can make, and how you can avoid them. Managing medical bills can be a challenging task, as you know, and mistakes in this area can lead to some significant financial strains and confusion. But if you understand the common pitfalls and take some proactive steps, you can navigate the world of medical billing with a little bit of confidence. And if you want to learn a little bit more about how to do so, please subscribe to this page and share it if you found it valuable. Number one reason many people suffer what's called a surprise medical bill or something that they may think of as a mistake comes from a lack of understanding of their insurance coverage. It's a really common problem, especially when you look at how um, the insurance companies sometimes they try to make it easy for us to understand, but it's almost like paralysis by analysis. Especially if someone, for example, is turning 65, the amount of information that they're bombarded with is unbelievable. Um, but as you're going through that, it's often common for people to not understand what they're actually buying. The old adage of "you get what you pay for" couldn't be more true than it is with insurance. And so it's important for you to review your policy thoroughly, including your deductibles, co-payments, co-insurance, and out-of-pocket um, risks, I guess I would say, and familiarize yourself with the terms and conditions that are in your policy to avoid unexpected charges. Another area where mistakes can be made is failure to verify billing accuracy. There's all kinds of numbers, and I'm not going to throw out a statistic because it's really ranged quite a bit. But mistakes and inaccuracies can happen in medical billing. So take time to carefully review each bill that you get and ensure that the services and treatments that are listed are accurate and were indeed what you did receive. Look for any charges that might be double or out of the ordinary. Look for incorrect codes. Say, like, you just went in for a checkup and lab work, but you see a bill for an x-ray. One of these, like Sesame Street says, one of these things is not like the other. Make sure to look at that and notify your provider of any billing things that may look inaccurate, and make sure to request an itemized statement. Another place mistakes can be made along the billing cycle is not checking your explanation of benefit. This is another area where you can can maybe catch something that may be incorrect. An explanation of benefit is something that you get in the mail after you go to the doctor or to the hospital or get a test that says this is not a bill, and it outlines what the charges are and what your responsibility will be. And it's usually takes about 30 days for that to play out between the insurance company and the provider. And then you're left with what they say that you owe. Now, this is where you need to again make sure that all of that information is correct, because you don't want to be getting a bill for something that you didn't have done to you. Another area where people make a huge mistake is ignoring these these errors. And if you spot errors and discrepancies on your bill, make sure to take immediate action. Don't just forget about it, or well, you will forget about it if you put it off. So it's really important for you to take immediate action. Talk to your billing department of your healthcare provider or insurance company to discuss the issue so you can request any corrections. And it's important for you to advocate for yourself to ensure accurate billing. If you're unable to advocate for yourself and need someone to help you do that, consider reaching out to us at Bellis and see how we can help you. Another area where mistakes can be made is failure to negotiate medical costs. Um, Sometimes medical bills can be negotiated. It really depends on your situation. But if you're faced with a high bill or financial hardship, don't hesitate to reach out to the billing department or financial services department of your healthcare provider and see if there are any options out there. Now, the number one thing in any negotiation you should do right away, regardless of the size of the bill, is try to get on a payment plan if you can, um, to not disrupt your monthly cash flow. And it varies by institution or provider what that payment plan can be. But in general, I try and make mine as affordable as possible, as to not disrupt anything else in my lifetime, in my lifestyle, as a result of a medical bill. And so it's much easier to pay it off. Say you have a charge earlier in the year, try and get, say it's $3,000, try and get that to pay. I mean, even if you could get it to $100 a month, I don't know if they would do that. But again, it depends on the policy. Sometimes they want it done within 12 months, sometimes 18 months, 24 months. But also, depending on your income, there are programs out there that might be able to provide financial assistance, and some of these institutions may forgive some of that um, medical expense that you may owe. Finally, one of the areas that is a problem in insurance and can cause to medical billing mistakes is lack of communication with between insurance providers and maybe even the hospital. Open and frequent communication with your insurance provider is crucial. Make sure to know where that membership services number is on your ID card. Keep them informed of any changes, such as any prescriptions or upcoming procedures. Same with all of your healthcare providers as well. And understand pre-authorization requirements to avoid unexpected denials. This is a big one, and this is one we're going to be doing a video on coming up very soon, the importance of pre-authorizations. But it's important to have a relationship with your insurance company too, because they're going to be working with you in this whole process as well. So the key takeaway is to avoid common mistakes in medical bills. It's important for you to maintain control yourself over your healthcare expenses. Understanding your insurance coverage, verifying billing accuracy, reviewing those explanation of benefits, and addressing errors promptly, as well as negotiating payment plans, trying to capitalize on any rebate programs or financial aid opportunities out there are paramount for you to consider. And by taking these proactive steps, hopefully it will help you save some money and provide a little bit of peace of mind as you navigate this complex healthcare system out there. And we're here to help you with that at any time at ED Bellis. If you would like any more information, please check out edbellis.org. Check out our podcast, America's Healthcare Challenge, available where you can get your podcasts. And please subscribe and share this video if you found it useful. Thank you, and we'll see you next time.